Is chiropractic safe after spinal surgery, and why would you want to get adjusted after spinal surgery? I'll explain. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. Is chiropractic safe after spinal surgery? A lot of people ask that. We get phone calls and people wonder. But before we can answer that question, we need to understand what chiropractic truly is. Because chiropractic is not about twisting and popping and cracking the spine. That is not the mechanism by which chiropractic works. So how does it work? Well, in the body, there is a passive system. So the bones, they can be aligned or misaligned, but only based on how the muscles are acting on them. And the muscles are only going to act on the bones based on what sort of information, what kind of signals the regulating system or the brain is sending to the muscles. So if we have a misalignment in a bone, it's because, or lack of movement in a bone, it's because the brain is not sending the right signals. So that's either because the brain is incapable or because the brain doesn't have the true picture. It doesn't know what to do because it's misinformed or confused. So the brain controls everything in the body, but it can only do that based on feedback because the brain is essentially blind. It's never seen or heard or touched or felt anything. All the brain knows is based on the signals, the billions of bits of information that the brain receives that paints a picture for the brain so that it knows what the world looks like. If it has a true picture of the world, it can act perfectly. If it doesn't know what the world looks like, it has to guess. And once we understand that everything is about signals, that the brain regulates by sending out signals, it understands the world by receiving signals, we also have to look at what are the different factors that can influence signals. So the human body-mind is chemical, structural, and emotional. We have chemical aspects, we have structural aspects, we have emotional aspects to our body, to our physiology. And all of these things can influence how signals are processed. So in addition to getting chiropractic and moving, which is a structural mechanical influence, we also need to understand how to take care of our emotions by relaxing, by meditating, by feeling good, and not least by getting proper nutrition and not being toxic. So this is the triad of health. This is what influences signals. The brain runs on signals, the body runs on signals. So what does that have to do now with spinal surgery? Well, movement, the movement of a joint, the movement, the tensioning and movement of a muscle, these receptors from joints and muscles provide about 90% of all the information that gets to the brain. And that's the purpose of the brain, is to receive that information. If the brain gets plenty of information, it is being stimulated, it's being activated. It's like a muscle that's being made to work out. If you work out a muscle, it stays healthy and strong. If you're a couch potato or you get your arm in a cast, then that muscle atrophies. The same thing happens in the brain. If we don't send it a certain amount of signals, then it's going to atrophy. So when you have spinal surgery, you are typically going to fuse one or more segments together, two or more segments together, and the motion that used to generate signals for the brain is no longer there. So now the brain is suffering, the brain is starving for signals, and the brain starts to atrophy. So you're essentially starting to get soft spots of degeneration in the brain. So what can chiropractic do for that? Well, it's not just the moving of bones or moving of joints that generate signals. It is also any kind of pressure or activation of muscles and receptors in the tissues surrounding the bones and the joints. So we can't move the joint. If we think that chiropractic is moving the bone, then obviously then this person's not supposed to have chiropractic because a fused joint is never moving again. But if we understand there's many other ways to activate receptors, there's still plenty that we can do for that person. So not only is chiropractic safe, but it is more important than ever because there's less movement in the spine, there is less stimulation for the brain, and the brain is starving. We need to do everything we can to get as much signals, as much information as possible up to that brain so that it can function and manage the rest of the body best it can. So if you know someone who has had spinal surgery, then make sure that they get to share this information, that you share this information with them so that they can start understanding this, and then go look for a good chiropractor who understands the neurology of the adjustment. Don't go to someone who thinks he's going to crack that joint that has been fused. Obviously that's not going to happen. But find someone who can use a gentle adjusting method like activator or arthrostim or some other tool, some other adjusting tool. So this is very important information. It is life-saving. And if you enjoy this kind of information and you're new to this channel, make sure that you subscribe and hit that notification bell so that we can keep this information coming your way. And as always, thank you so much for listening.